Characteristics and treatment options of glucagonomas, a national study from the French Group of Endocrine Tumours and Endocrine Renatin Network by Perrier et al. Glucagonomas are functional pancreatic neuroendocrine tumours, PANNETs, which mostly occur sporadically. The data surrounding their clinical features and management is limited due to the rareness of patients with glucagonomas. However, current evidence shows that they are typically associated with diabetes mellitus, weight loss, and a rash known as necrolytic migratory erythema, NME. The aims of the study are to provide data on the clinical and histological diagnosis, prognosis, and management of patients with glucagonoma, exploring the impact of treatments, tumour burden, and survival. This was a nationwide retrospective study involving 23 French Group of Endocrine Tumours centres. In total, 38 patients diagnosed with a glucagonoma were recruited with a mean age of 58.7 years. All alive patients were informed and gave their consent for the collection of their anonymous data. Most PANNETs were located in the pancreatic tail and measured 5 cm on average. The majority of patients were found to present with NME and weight loss. Half of the patients had recent onset diabetes mellitus, and almost 30% of patients had a history of venous thromboembolism. Surgery of the primary PANNET was performed in 29 of the 38 patients, mainly with curative intent. After surgery, complete resolution of the NME was seen in 15 of 16 patients. 32 out of 38 patients were recorded with metastatic glucagonomas, who were most frequently treated with therapies such as systemic chemotherapy and single-agent somatostatin analogues. Median overall survival of the whole cohort was 17.3 years, and median overall survival of patients with metastatic glucagonoma was 6.8 years. In summary, firstly, there is significant morbidity associated with glucagonomas. Secondly, surgical resection with curative intent should always be considered in the management of glucagonomas. Thirdly, therapies such as chemotherapy provide substantial anti-tumour and anti-secretory efficacies. To read more, please scan the QR code or use the link provided.